Hello everybody. I know I'm typically talking about fluoroquinolone toxicity syndrome and everything related to fluoroquinolones, but today I'm going to be talking about something a little different. I frequently have people reaching out to me, and one came across today that perplexed me. I had never heard of it before, but when I researched it, I saw that this is a very big issue. That like fluoroquinolones and even gadolinium toxicity, all the kind of toxicities out there, people aren't really talking about them. Today I was contacted by a woman that took a drug called Mefloquine. As soon as I say that word, Mefloquine, anyone that's been floxed is going to resonate with the last part of that word, Mefloquine. So I immediately went to truthaboutfluoride.com, looked it up, and it is a medication that contains fluoride. The woman that reached out to me took this medication in 2023 when she went on a service trip with her college. It was prescribed to her for 8 weeks as an anti-malaria drug. Obviously, she was going somewhere where that disease was a concern. She took the medication for 6 weeks, and within that time started experiencing strange symptoms, and she stopped taking it 2 weeks early. My heart goes out to this woman because she's so much like those of us that have been floxed, because you don't hear about Mefloquine toxicity. I've never heard of it. People don't know about it. It's not recognized. She went to her doctors. What do you think happened? The same thing that happened to us. Nobody believes it. Nobody knows what to do. Nobody knows how to treat it. So here she is at a loss, like many of us, not knowing what to do and very, very sick. So let me tell you a little bit about Mefloquine. It's a medication used to treat and prevent malaria. It is used based on recommendations from the Centers for Disease Control, CDC, to help prevent malaria for travelers. It has also been administered to both military personnel and those serving in Iraq and Afghanistan, and civilians, although it is used much less than it has been in the past. And what is malaria? For those of you that may not know what malaria is, it is a serious infectious disease transmitted by mosquitoes, typically found in areas of Iraq, Afghanistan, and many areas in Africa, South America, and Asia. Mefloquine was approved by the Food and Drug Administration, FDA, in May 1989. In 2013, the FDA published a safety alert on Mefloquine and then added a black box warning. That's the strongest warning a drug can have. The FDA black box warning points out neurological side effects that can include dizziness, balance problems, feeling like you or things around you are spinning, loss of balance, ringing in ears, convulsions or seizures, insomnia, psychiatric effects, which can include feeling anxious and restlessness, paranoid, depressed, or having hallucinations. The FDA states that neurological or psychiatric side effects may occur anytime during drug use and may last for months to years or be permanent. Sounds a lot like fluoroquinolone toxicity, the way it works. I don't know if that's because it's fluoride in the medication, but the FDA states that most people were healthy before taking this medication, and some patients did not suspect that their symptoms were due to the medication because, again, they were in another country and thought that maybe something was happening because they were there and it wasn't necessarily the medication. The woman that reached out to me is experiencing all of these adverse effects and has no idea what to do. Doctors are looking at her like she's crazy, and like those of us that have been floxed, she's just looking for a diagnosis and treatment and doesn't know what to do. So I figured I would create this video because it can reach the masses and ask everyone out there, first of all, have you taken Mefloquine and have you experienced these adverse effects? 2, if you did, what did you do about it? 3, Are there any doctors out there, even naturopaths, functional medicine doctors, regenerative medicine doctors, that have heard of this? Has anybody heard of this? And 4, is there any way to treat it? Can similar treatments be applied to Mefloquine as fluoroquinolones, which is basically like, supplementation and antioxidants and stuff like that? The Chronic Illness Club is the club you do not want to be in. So if anyone is out there that can help, please leave comments. Thank you, everybody, and my heart goes out to this woman. It is such an unfortunate situation, and one that we see all too often.